Good morning, Mr. Boblet.
Hello, good morning.
Hi, I'm just washing my hands for you first.
Thank you.
My name is Dr. Gunderson.
Nice to meet you.
You
It's
too.
my wife, Hillary.
Hi. Nice to meet you. Something so simple as trying to get to their level, looking in their eye, and even if you're able to show that you can sit for a little bit, even if you still are pressed for time, it gives the appearance that you're not. And that time that you're with them is really important. First of all, I'm your supervising physician here with an internal medicine. And I see that you see Dr. Miller.
Mm-hmm.
So I do see Dr. Miller's patients when they're admitted to the hospital here. How was your night last night?
What patients worry about, although they want to be in the hospital, they want their problems managed, the most common thing that they're worried about is how long do I have to be here and when can I go home, which is understandable. So what I'm always trying to let patients know is that I'm anticipating that I'm trying to get them home or to the next appropriate setting. Most people with pneumonia are generally in the hospital for about 2 to 3 days. Sometimes people can go home in as soon as 2 days if they get well. Sometimes they need an extra day if they're having a little bit of difficulty. That is an average. And given your age and your medical history, I suspect that you'll be at average or maybe even get better a little bit sooner than that.
So the nurse is going to come in, we're going to draw some blood work, we'll get all the tests. Everything should take about 2 hours altogether, just so you have an idea.
Explain medicines, procedures, and things that they make sense to them in ways that they can understand it. Have them repeat it back to you so you make sure that they're getting the information you want them to do. At any time we're talking about stuff, you just stop me and ask questions. Okay, so the reason sometimes a C-section could happen when a woman is in labor, there's 3 things I need to have go well.
Once again, we want to explain to people what's going on so they have an understanding of what's going to happen. People are really nervous. They don't know what's going to happen. They don't want to be in the emergency room. They're worried. So if we can give them some idea of what's going on, the thought process in which I'm trying to accomplish things, what are some of the potential things that could be causing the problem, this helps us to ratchet down some of the fear, some of the nervousness. A lot of times when you get chest pain, it's not related to your heart, especially for someone like yourself that's young and pretty healthy. You have to think about, could it possibly you've strained the muscles of the chest wall? Possibly you made it worse when you took a good run. But we'll make sure, and what the tests show, and of course a big part of what I want to do here is give you some peace of mind so that when you leave here you're feeling better about what's going on. We have a plan in place so that we know we can get you feeling better.
Sounds good to me.
Thank you so much.
Okay, great. Well, it was good to meet you, and thanks for trusting us with your care.
Thank
Okay,
you.
we'll see you later.
Thanks.
Take care.
You're going to leave here with the baby. This is all about you today, okay? Okay, thanks.